I had no idea that I'd ever be teaching technique. This was totally accidental to me, and it occurred because I was in horrible pain. I was in a bad accident. It wasn't a car accident. I had been hit in the head by a piece of furniture that was laid on its side when we moved into our house. I closed the door. Big piece of laminate furniture, about 7 feet tall, weighed a few hundred pounds, very sharp edges. So it was on its side. I closed the door, and it fell. Just toppled over on top of me. I was totally blindsided. I had a concussion, and I almost lost my 3 fingers. There's still scars on it. Fortunately, my head was in the way, so that stopped and I would have lost those fingers. The cuts went very deep. So, you know, when you have a concussion, you go to bed about 4 o'clock in the afternoon, and you sleep, and you don't feel right. And within a few days, I lost use of my hands. I remember Seth was an infant then. You know, you pick up babies. I couldn't pick them up. To make operating scissors was impossible. And I started getting a lot of work done on me, and it seemed to go away, and then it came back with a vengeance. Everybody worked on me. I know I saw, well, at the same time, I'd had about a 20, 25 year, actually 25, 30 year lumbosacral disc problem that had been getting worse. And, you know, the worst thing in the world is not to have a problem. The worst thing is for it to be getting worse, and you don't know what to do, and you're watching yourself get worse. Hopelessness or helplessness is the worst emotion. They say it's worse than depression. And I was feeling a sense of helplessness, watching my body deteriorate on a regular, and I'm getting adjusted constantly. Well, I figured the adjusters in my area weren't helping, and so I decided to travel around the United States, and I went to just about every technique. I had people work on me, the top names, and I didn't get any lasting relief from any of them. And then I was going to physical therapists, osteopaths, craniosacral therapy, body work, medical doctors even. You know, when you're desperate, you'll do anything. And I traveled all around getting work done. Acupuncture, too. Had one acupuncture. A very nice lady from China. She was not far from where we live. So I went to her, and she looked at me, you know, stick out your tongue. And I like acupuncture a lot. I like Chinese medicine. And I asked her, what do I have? You know, tell me what's going on. And she said, you have arthritis. I said, I don't have arthritis. You know, in that system, you never question the doctors. But I was not going to play games. I don't have arthritis. I said, can you give me a Chinese diagnosis? So she said something in Chinese. I figured my triple heater is off, you know. My meridians are out of balance, something. I said, oh, great. What does that mean in English? She said, it means you have arthritis. Helplessness continued. And I was getting really bad. There were days that I couldn't walk more than 10 feet without the sciatica getting so bad. I had to sit down, or I'd go into a crouch. Middle of a city. The family's walking. I just have to, and after about a minute or two, I seemed fine. I'd get up and I could walk 10 more feet. And it was getting real bad. My hands were constantly fat. They felt fat, like large rubber bands were around my wrists. And they started breaking. And it started bleeding. There were days I'd bleed on patients. And that's how bad it was. So I was in Florida with the family, and we ran into, I was desperate. And I remembered we were on Key Biscayne and Alan Creed, who is yet to take a seminar, and he promises he will. So Alan practices in Key Biscayne, and we came to see him, and I was desperate. And he used all these gadgets on me. And something he did took the edge off. No one ever been able to do that before. So when we got home, I just ordered everything he had. And it was shipped up, and I started experimenting with it. And it was accidental. But I realized if I combined things from DNFT, Directional Non-Force Technique of Van Rump, and Stressology, which was developed by Lowell Ward, which not many people know of, using adjusting instruments, I could adjust myself specifically. And I knew if I was out, where I was out, and if I fixed it. Now, I'd always done like diversified and all the cracking and popping. You never really knew if you got it or didn't get it. I mean, it sounded nice. It was very satisfying to the doctor to hear all those noises. But if you didn't get the noise, you tried a little harder. And it was hard on the patient. But, you know, action, reaction, any force comes back at you. It was hard on the doctor. I know 4 doctors in my area that had surgery from adjusting. Arm, shoulder surgery, hip surgery, whatever. And I suddenly realized, wow, I can work on myself. So I started working on myself. And Beth was a little surprised because she heard the arthrostim instrument going. She looked outside and there were no cars in the driveway. She says, what is he doing with this thing? And within about a week, my 6.5-year hand problem disappeared. And it took me about 6 weeks to clear up my 25, 30-year lumbosacral disc problem. Would have taken 3 weeks, but I didn't know what the hell I was doing. I was experimenting on myself. Beth had migraines monthly, sometimes weekly. You know what it's like when you can't help a loved one? You know, it's horrible. Here I am, I'm adjusting her, and the migraines are going, and she'd throw up, and she'd have to take something. So I ran upstairs to the bedroom, you know, with the instrument. Dad, you got to see this. And I checked her, and I found the sphenoid out, and I adjusted it, and that was about 3 years ago, and she hasn't had a migraine since. And these kind of stories, I said, well, is this going to only work, actually? Is this technique only good for chiropractors that write patient education literature? It might be a very small population that this works on. You know, n equals 1, maybe, and my wife, n equals 2. Or will this work? So I wanted to find the most difficult patients in the world, who were, of course, chiropractors, who had been adjusted hundreds of times using different techniques and were still a mess. So when I'd go to my seminars, you know, my regular seminars with philosophy and research and vaccination and the connections of health and the stuff that I've done for many years, speaking on, I would make an announcement right before the break. So anyone here who has a chronic problem, you've been adjusted for years, you're still not well, see me during the break. And I dismiss them. I figured 1 or 2 guys would show up. The line went out the door. These are chiropractors. I said, our profession is in trouble if we're all sick and we're getting adjusted. And doctors would confide in me, and they'd say, you know, some days I'm in more pain than my patients. So I said, there's something serious. The profession is subluxated. There's something seriously wrong. And I began working on these people, and the responses were incredible. And I began to realize I really have something. And people would say, when are you teaching us? And I'd say, I'm not. And they'd get upset, but I didn't feel ready. And for about over a year and a half, I went around the country and started just adjusting doctors at seminars. You know, just saying this, I found something new, I'd like to try it on you. And then one day, I was lecturing in England for the McTimoney School there in Oxford. And they gave me 16 hours to talk, 2 days. The Europeans don't have this half-day Sunday thing. They just do both full days. So I thought, what the hell? I've got a little extra time. Let me show everybody some of the things. I spent a couple of hours giving them the basics. And I started getting emails from people a few weeks later about all these miracles that were happening in their practice. So I said, okay, I think we're ready to start teaching. So in May of 2005, we gave our first seminar, and we haven't looked back since. This work is based on really one thing only, and that's results. It's, I can give you all these theories and everything. What really matters is, can you get yourself better? Can you adjust your patients and get results like you've never seen before in your life? And that's what we're going for. It's from, as I said, directional non-force technique, DNFT, spinal column stressology, and the arthrostim. Anybody knows these techniques, you'll very quickly see where I got inspired from. Also, a number of other people were very instrumental, and in the book there's an acknowledgement section. And in addition, there's also and I started reading technique books. I never really was that interested in technique before. Suddenly it became personal. So I started reading stuff from Desjardins and Goodhart and others, and I began to see how, and I sort of rediscovered stuff that they discovered. So I knew I was on the right track if I was rediscovering their stuff. And also I was sort of rediscovering a lot of Van Rump stuff. We had a real problem figuring out a name for this technique. First I thought DNF Ted would have a ring to it. Gonstead sounded good because that name was already known. I thought just add an extra D and we're all... But then somebody said something about lawyers and we backed away from that. Totally Effective Disharmony Destroyer is what my wife thought was a nice name because it spells out Ted. A synchronous hand instrument technique I came up with until we figured out what the initials spelled. So we didn't think that that would fly too well. Although one state approved it under that name. It's like nobody figured out the... and chiropractic reductionistic adjusting protocol also couldn't work because it's not reductionistic. So let me move some of these away right now. So anyway, so we thought Koren specific because people know my name in the profession. So the benefits are you can accurately, efficiently, and quickly analyze and correct subluxations anywhere in the body. Spinal column, skull, pectoral girdle, pelvic girdle, ribs, sternum, extremities, anywhere. Now, coming from Sherman, that was like, you know, heresy, because I was taught upper cervical. You know, BJ was worshipped for his technique, among other things. So this was a really big jump for me. And the reason why I acknowledge upper cervical work, and I like it a lot, and it's very important. The reason why we moved to a different view was because in this work you ask the body. So I figure the body knows more than me. Innate knows more than the doctor. You know, here we are telling people, well, innate has to do this. Innate says only adjust the spine. And innate doesn't say that because we're asking the wisdom. We access the wisdom of the body with this work. And if the body says go here, you go there. So I decided I'd humble myself before the wisdom of the body and follow where it led. And it will take you to really great places. With this work, you will become a detective. This is no technique where, well, if a person has this, you do that, and a person has this, you do that. This is not like that. We give you a protocol, and you become a detective and discover it. Everyone is totally unique. You know, 1,000 people with migraines may have 1,000 ways it's what's causing it. And you can ask the body and find that they're unique stress, subluxation, and environmental patterns that are creating the problem and release it. So this is the cool thing about this work. One thing that told me that I was onto something was that I was seeing retracing. We have a brochure on retracing, and I think it's in the book, a little article on retracing. Retracing is the only real measure of healing. It means old injuries are coming to the surface, old stresses, and it could be physical or emotional. When things come out, and in my lecture, Connections of Health, I get into retracing more, but this is the only real measure of healing. If you're not getting retracing, you're not really getting healing. And of course we discuss it in chiropractic. In homeopathy, they call it the law of cure. It's been referred to as Herring's law, and it's been known, you know, for millennia as the way the body heals. Old symptoms come out. It might come out in dreams, might come out emotionally in front of a person, might come out as physical symptoms, but there's a release. And that's what really told me I was onto something, because I did not want to discover a glorified aspirin. Now, for too many of us, too many of our patients, that's what chiropractic is, a glorified way of getting rid of pain. And that's not what it really is. We want to really heal people from the inside out and make them whole and healthy. You want to adjust people, and you won't see those subluxations again. Their subluxations heal. Because you can lay a person down, and you know, I come from that diversified background also. I know I can lay them down 3 times a week and crack their backs every time for years. And maybe we have patients like that. They don't really heal. You're releasing stress patterns, you're cracking them, and then they get it all over again. With this work, you adjust them, and you won't see the same subluxations again. They will actually be better. And after a while, they'll be clear. And this is the beauty of our work. And the great thing about it is you could do it to yourself. That's the real cool thing. I mean, what's it worth to be able to adjust yourself and keep yourself clear the rest of your life and your family? So that's part of the beauty of this. And to me, it was personal. That's why I was so excited. Now, it's possible to check and adjust a patient in any position, standing, sitting, laying down, or especially in a position of dysfunction, injury, pain, position of subluxation. You want to bring out the subluxation. And subluxations are posture specific. In other words, a person who was in a car accident and got a whiplash, just to use a crude example, they are best adjusted or checked sitting, because they were sitting when they got the car accident. The damage happened in the sitting posture. And Dr. Ward discovered this. You can have somebody standing, take an x-ray, they look fine. Sitting, they're a mess, because subluxations are posture specific. And by posture, we don't only mean physical posture. It's emotional as well. The word posture can mean an emotional or a physical state, and that is perfectly applicable to this. I mean, you adjust somebody, that you clear them out, and they think of their ex as they're walking into their car in the driveway, and suddenly they're all subluxated again. Well, what do? Well, you check them while they're thinking of their ex, and you adjust them when they're in that state. You can actually check and adjust people when they are thinking of their serious, most severe emotional stuff. You can adjust somebody laying down, but if standing is when they have the subluxation, when they stand up, they're going to be subluxated again. So we ask the body, what's the best posture to adjust a person in, and you adjust them. And that's one reason why you get such good results. I mean, I had one guy who was a guitarist. It only hurt when he was playing the guitar on stage. So he brought the guitar in, and he held it, and I checked him, and he was subluxated in that state. I cleared him out, by the way, before he held the guitar. He was totally clear. He picks up the guitar and holds it, and suddenly he's subluxated again. I adjusted him then. After that, he had no more problems on stage. And you can say same thing with golfers. I'm left-handed, so. Or is it this way? Never mind. But golfers, you can bring in the club or whatever. Go into the position. Tennis players, anything. Any position. Oh, well, it hurts me when I sleep on a certain way. Okay, lay them down, go into that position, and adjust them while they're in that posture. You check them and adjust them. So you check and adjust patients wherever they need it. And that is one of the reasons why, again, the adjustments are so long-lasting. I tell patients before they leave my office, I say, make it hurt. And they look at me like I'm crazy. I say, make something, if they came in for pain, of course. Not everybody does. Make it hurt. And they think I'm crazy, but I wanted to bring out the subluxation. And then you check them and adjust them while the subluxation is revealing itself. So this is a vitalistic or an empirical technique. That's the beauty of it. It is not mechanistic. We're not telling the body what we think it should do. That is saying subluxations are only C1. Right? Only upper cervical, that's it. That's not life. That's not reality. We're asking the body. We're not saying we know better. We are humbly asking the body, reveal to me. So we are learning from the body what it wants. We talk about innate. Well, let's use innate, not just in philosophy, but in real life, in working with patients. So we're asking what the body wants. We learn from the body from what it's telling us. Technically, it's called a posteriori. We're respecting the wisdom of the body and learning from it. So this is not mechanistic. We don't know what the body supposedly wants. We're not intellectually deciding what the body wants. Mechanism is also known as rationalism. And these are philosophical stances. Chiropractic is philosophically vitalistic or empirical. We learn from reality. We learn from the body. It is not mechanistic, where we're telling the body. Medicine is mechanistic. Well, we feel that this is the way the immune system works, and if we inject this into a kid, we believe that antibodies will produce that will make the kid healthy. That's a mechanistic model. Well, we believe the heart is like a pump and just plumbing. And if you have a clogged artery, take it out and replace it with another one. That's all it needs. That's mechanism. None of it works, but that's the medical model. As they say, MDs don't really care whether it works or not, just whether they understand the mechanism. It has been said. Whereas real healers, empiricists, homeopaths, chiropractors who are doing it right, say, well, the important thing is not necessarily knowing the mechanism, because we never really will ever know the mechanism in its totality, but whether or not we get the patient better. That's the most important thing, and we seem to have forgotten that in many areas. So our goal is to get the patient better. The mechanism will ultimately, possibly, I shouldn't say ultimately, possibly be discovered one day, but maybe not. Life is full of mysteries, and the more we try to understand, the deeper the mystery gets. That could be frustrating to an intellectual, but to others it might be the best part of it. It's fun. So this technique is the 3 C's. That's the technique. So the 3 C's are simply challenge, check, and correct. And I'll go into them in detail in a few minutes, but right now, I thought it would be a good time just to introduce the teaching assistants, and I'd like them to say a few words, because they're going to be walking all around, and they're going to be bothering you, hopefully teaching you, and we're going to, they're going to work with you, and there are a number of people who've come for a second time, or a third time even, just for refreshers, who will also be able to work with you.
Hello, I'm Greg Schwartz, and I practice in the Ambler, North Wales area, not far from where Ted lives. And when Ted was first starting to put this concept together, I was over his house and he adjusted me, and I was very pleased with the response that I got, very surprised. I felt more open. I didn't realize that I wasn't taking as deep of a breath. And when he adjusted my ribs, I took a sigh and felt more air. And he asked me if I can feel this, what he called the OD. He had me put my hands on my head, and he had me feel to see if I could feel this drop, as he called it. And I was able to. He was very pleased because he felt that if I was able to feel it, then he would be able to show other people to do it. And that's how I got involved with this. When he had his first seminar a couple years ago, he asked me if I wouldn't mind being an assistant at that time period. Since that time period, I've been working with the KST and finding it very, very helpful to be more thorough. And I think a lot of the doctors here are going to find that they're going to be able to find things that they weren't finding before. Just with that alone is going to make them a better doctor and be able to get better results with their patients. This is going to be able to, as he was describing just a little bit ago, to be able to find cranial bones and TMJ and every other joint in the body, including, beside the spine, also the extremities. So hopefully you'll enjoy this experience. You will be able to do this by the time you're done. If you're not, Beth will give me a hard time, and I don't like to get a hard time. So please, if you're having any problems, ask me, ask any of the other people that are assisting, or Ted.
My name is John Foley. I practice in Belmar, New Jersey, which is right across the river, South Jersey. Went to Palmer College and graduated in 1979. I went to KST. My first seminar was about 1.5 years ago. And when I first started out, I had a little bit of difficulty picking it up. And that's another thing. You'll find that when all of us talk about our experience, we're not going to, snowball you and tell you something that we haven't experienced. So my deal was that I had a difficult time picking it up from the beginning. So what I did was that I saw the great results that other doctors were getting, and I watched Ted and how he did the adjustment, and I said, I want to do that. I want that for my practice. So I went home, I went to my office, and I did cranials and cervicals on every single patient for 2 weeks. And I did my other procedures also. And I got such great results from doing that little bit of KST on my patients that I decided I really have to get into this and really know how to do it. During that first 2 weeks, one of the significant results that I got that really convinced me I had to really focus in and practice was a little girl, 7 years old, and every morning when she woke up, she was nauseous and couldn't eat breakfast. She couldn't eat till about 12 noon. And luckily she was homeschooled, and so, she could eat her breakfast, around 12 noon. So what I did was I did the KST procedures on her, and I found sphenoid anterior, occiput inferior, and C2 subluxations. And that's all I did on her. It took me about 30 seconds to work on her, and that was it. And the very next day, she was fine, no problem. Whereas before, when she ate breakfast early in the morning, she would vomit. And so she was waking up and with no problem. And I saw her recently, about a week ago. The family comes in regularly, and she hasn't had a problem since that time. And that's 1.5 years ago. So that really impressed me. So I thought, if I can be that successful without feeling I really know completely what I'm doing, then I really need to focus in and, learn how to do this really well. So that's what I did. And some of the results that I've had recently in my office, one of the things that you'll learn that we can do with KST is position of pain or position of injury, where you get the patient to move into the position that the injury was caused. And just recently I had a woman, if you can picture this, she was on the passenger side, outside the car, opened the door on the passenger side, and leaned in to pick up something from the floor, and had excruciating left low back pain. And she has a history of herniated disc, stenosis, degeneration. So she came into my office and told me what happened. So I had her assume that same exact position right in my office. She bent down, had her hand on the door of the car, everything, leaned down, reached in, took her hand off the door just as she performed it at that time. And while she was in that position, I checked her and I found a subluxation in the right sacroiliac joint. And I adjusted that in that position. She got up and it completely resolved right at that time. Another case that was a little more difficult, a regular patient came in and he injured himself at work. And I was working on him and I couldn't clear him out. He improved, but he just wasn't getting completely better. So he kept coming back and saying, you know, it's starting to get worse. I don't know what the problem is here. I said, I don't know either. So I had originally asked him about the position of pain, but he really didn't get into detail with me. So as he was leaving the office, he said to me, you know, it's really funny how this happened. I had my leg up on a shelf. I was reaching with my nail gun, you know, to put up some drywall, and that's when it happened. I said, come on back in. So we assumed that exact same position right in my office, and I found a subluxation that did not appear before. And I corrected that, and things completely resolved. Do I have time for one more? Huh? Okay, just one more quick one. This is something kind of neat that I've never done before in my practice, is dealing with emotional problems with people. And this woman came into my office, and she was in an auto accident. And she had some problems with her neck, low back, and whatnot. But she was very upset about the fact that it happened. So what we did was had her seated on the adjusting table and had her assume the exact position that she was in at the time of the accident. Had her hand like it was on the steering wheel, her feet in the exact position, and then recreate the accident in her mind. And when she did that, I then corrected the subluxations that I found, and she said to me, I've been really feeling like crying ever since this happened. I said, that's all right, go ahead. And she released that tension, started crying right in my office. And it was really neat because she's a psychologist, and she was really impressed that this happened this way. And now she's referring patients to me that she feels there's a physical connection to their emotional problems. In fact, there's a patient, one of the patients she has recommended to me is coming in on Monday morning. And when she called, she told my receptionist, be sure to tell Dr. Foley that, you know, I have a lot of back pain, but that I have problems with anxiety and panic attacks. So it should be interesting to check her out. So there's some of the things that have changed in my practice. I was strictly diversified before I started KST. So looking forward to working with you this weekend.
My name's Tony Riello. I practice in Brick, New Jersey. And before coming to Ted's seminar, I was a straight chiropractor, diversified. And this was a pretty far-fetched concept for me to grasp. I'm pretty analytical, et cetera. And I'm sure there's people in the audience who are very similar to me in being analytical and maybe straight chiropractors. However, you know, after about 10 years of practicing, I just wanted to get better results. I wanted to be more of a healer. I wanted to do more in my practice. So it just came about that I ended up sitting in the same seat you're sitting in. And I guess the point I want to stress to you is you're probably sitting there very similar to the way I was. Skeptical, not sure, is it something I want to do, arms crossed. And I was the same way. And I was probably that way throughout the whole seminar. But what I did do was stayed very open-minded, paid attention, and made a decision after it was over rather than before it started. But the things that I've seen in my own practice, because you can hear everyone speak and talk, and they can make things up if they wanted to, but I can tell you that they're not, because I've had things happen in my practice I've never seen before. You know, for example, had an older woman who was a previous patient of mine call me up one day, and I happened to answer the phone, and she said, I'm getting fainting type spells, not dizziness, fainting, like she was going to pass out. And her doctor, her cardiologist, said that she could be possibly having a stroke. Last person I wanted to talk to was somebody who was going to be having a stroke. So I went through the proper channels and spoke to the cardiologist, the whole thing, and they never said that. She just misconstrued some things, so I had her come in. But the long and short of it was, after about 4 adjustments using KST, that feeling that she had went completely away. I can't explain it, but it was interesting. And then on top of that, during the 4 adjustments, she told me she was getting a weird buzzing in her ears. And after, I don't know, 3 or 4 more adjustments, that kind of subsided about 90%. So right off the bat, and I wasn't even hardly knowing what I was doing yet, I started seeing results. So I was like, I don't know, maybe there's something to this thing. And I've been practicing 6 months with it, and I didn't switch my practice over and start doing 100% KST, which I know Ted's probably upset with me about, but I do use it. I use it often. I use it on tough patients, older patients, patients who don't want to get cracked, you name it. When I'm confused, when I don't know what's going on, I always seem to break it out, if you will. And if I need more answers, if something's not going the right way, I will use it. In the last seminar, which was my refresher, that I actually utilized in a little different way with a patient of mine who, a long-time patient, low back pain, young girl, and she re-injured her back bad, though. MRIs, disc problems, herniations, leg pain, significant. She was losing strength in her left foot, and started doing KST on her. I'm adjusting her. She'd, feeling a little better. She'd walk out. She'd come back like 3 days later like this again. Adjust her. She'd walk out. And I was getting frustrated. So after about a couple of weeks of doing this, even though we were getting somewhere, we weren't getting where we wanted to. The body was telling me something very odd. I would go to the lower half of the body, and then it would shut me off, and I would be getting no's and no's and no's. And then I did something that Ted had mentioned. I asked posterior or anterior. It said anterior. I'm like, okay, so then you check a few things anterior, and they came up now, and I was really getting frustrated. So I remember what Greg had said, looking for anterior discs, which right now is a foreign concept to you, it was foreign to me. But I checked, was it anterior lumbar disc? And his was an anterior cervical disc, so I figured, what the heck? And it said yes, right side, left side, left side. And I adjusted that spot. She said she got a sensation, electrical down her leg, and then it was gone. She's got 98% of that feeling back without having any tingling in her foot. And I didn't realize it at the time. She told me the next time she came in, because I said, how you doing? She goes, fine. I said, what do you mean fine? She goes, fine. Well, how you doing? She goes, it's gone. I said, well, when did it go away? She said, well, when you did that thing in the front, it just disappeared. I don't get it, but it worked. So enjoy yourself, have fun with it. It does work. It can work for you. It's not 100%. That's the thing that blew me away. I was on the forum like, yeah, right. No way. For me, it's not 100%, which shows that, you know, it's not voodoo. But it does work, and it works very well. So enjoy the seminar.
Good morning, everyone. I'm Bill DeMeo from Wayne, New Jersey. I graduated from Palmer College in '93. I took Ted's first seminar after I saw him he came to a Master Circle conference, and like he said after the break, if anybody wants to get checked, come on over. So I went over, and there was a line of about 100, 200 people. So I said, let me check this out. So I went to the first seminar, which was in Montgomeryville, which you guys are really lucky to be at this hotel because this is a big step up. And, you know, it's a lot of information at first. I would caution not to overanalyze it too much and just to have fun with it. I went back and took a refresher course about 6 months later. When I first took the initial class, I was good with the OD, but taking it back into my practice, being a totally foreign concept to patients that are used to coming in and getting adjusted diversified, they were like, well, what is this? What are you doing with the back of my head? You know, you're rubbing a bald spot on me here. So it's something that I was comfortable with, but just your confidence when you take that back into the office and you leave this setting. Try not to let those doubts get into your head. So I decided I'm going to come back and take a refresher. How many people here are taking a refresher right now today? Okay, good. So if you look around, you can see a lot of people that have come the first time weren't totally disappointed or scared away and decided they wanted to come back and hone in a little bit more on the skills. So I would definitely recommend a refresher. Real quickly, as far as results that I've gotten, even if you just take this and check cranials and extremities, you're going to notice some great results. A lot of retracing. So Ted's got a brochure on retracing. And what I did is I gave that pamphlet to everybody when they first came in and started to have KST done, because we had people that passed out or people that like emotional responses where they cry as you release layers of stress. So very important to explain to them retracing. And with this technique, at least I found that it occurs a lot more, probably because of all the cranial work that you do up in there. Just this past 2 weeks, I've had 3 people that came in with buzzing in their ears, ringing in the ears, one older man and 2 younger women. After checking all the cranials, one left that day and it was totally gone, and the next 2 said by the next day it was clear. So you're going to really get some great results. Another lady came in last week. Her husband, she said, you got to take me to the Medi-Center. I can't deal with this pressure on my face and the sinuses. And he said, well, let's call up, the chiropractor. So he brought her over. We checked her. She said, wow, I did like 3 cranials. And she was like, I said, how's your headache? How's your face? She said, it's gone. I said, same as Tony. Oh, cool. I don't know what we released there, but it worked. She came back 2 days later, built up a little bit again. We adjusted her again. She was fine. So we were able to prevent her from going on antibiotics or something like that. So I'm not going to take up too much of your time. You want to learn the technique and listen to Ted, but have a good time today. We're all here to help you, so make sure that you go around and feel everyone's got different heads. Make sure that you're comfortable getting the OD on different people's heads. Practice it on the TAs. We'll be able to help you and give you any pointers. And just have fun, enjoy yourselves. Use the forum when you get back. So the great thing about KST is once you leave here, it's not like you're isolated. There's a forum that has different for graduates, for people to go on about how to market this into your practice and things like that. So you have a constant support system where you can go in and ask questions. You will also be hearing from some of the TAs where we try and keep in contact with you and call you up. How are you doing? Are you getting it? Do you have any questions? Things like that. So utilize all those things, but try not to overanalyze it. Have a good time, and you're going to have great results when you go back to the practice. It's just like a whole new tool into your toolbox that people come in, you're used to adjusting them by hand. Well, now you have this new technique where you can check all sorts of things, visceral things. One woman comes in and has stomach cramping and spasms, and I check down here for, I don't know what I'm checking. I'm checking and challenging and using my negative finger, and it works. So have a good time with it. Don't overanalyze it, and enjoy.
I'm Dr. Carol Peterson, and I practice in Doylestown, Pennsylvania. I found out about KST because I came to one of Ted's philosophy seminars because I needed the credits. And he was talking about it, and he did a demonstration, and I just said, that's me. That's what I need. Because I also do other techniques in my office, like NET, and I also do cranial and sacral therapy, and I'm sure a lot of you are familiar with both of those. And when I started doing KST, the hardest thing was, because I was an activator chiropractor, though, prior to this, was getting my people off the table. Standing just in some of their minds wasn't allowed. They weren't real thrilled because they love the table. They love lying down. It's a very comfortable, large table if you're familiar with activator. But I found it very interesting and very similar to activator in a lot of ways. Activator, you read leg length. Here you'll read the occiput drop. And like everyone has been telling you thus far, a lot of things happen and you don't understand them. But you have to trust yourself, and you have to trust really the patient's body, because that's who's giving you the indications and the answers. It's not you, it's their body. A couple good cases that I had a woman who's been coming to me for years, who still is, and she would have improvement and do better, but I always felt like there was always something missing, especially emotionally. I could feel from her. And one day I was adjusting her, and her larynx was positive, and it was anterior, so I adjusted it, not thinking anything. She's signing out for her next appointment, and all of a sudden she started crying hysterically. And I was like, what's wrong? Do I have the wrong day or something, or do you have something planned? I mean, I was just like, I didn't know where it came from. And she said, no. She said, All of a sudden I started thinking about an accident I had in the car with my husband. It was very serious when we first got married. And after the accident, I didn't have a voice for several months, and they never could figure out what caused this to happen. And this adjustment, doing her larynx, brought that whole memory back. And she released there, and of course I calmed her down before she left. And ever since then, she's like a totally different person. She's more energetic, she's more vibrant, and I just see a big difference in her. I also teach, adjust, because I was about to say treat, and I know Ted hates that word. Treat and adjust many autistic children. And one of my autistic patients just recently, occasionally, he has cranials, and we're seeing a difference, and his mother said he's doing so much better in school. But the last time I adjusted him, I actually did his sutures. They came up. And amazing. He's like grown so much more from that one treatment versus the others prior to. So sometimes it happens right away, and sometimes it doesn't, and sometimes you'll get an immediate result. And working with the position of pain I found is very helpful. And also I find it's very helpful if those of you that are refreshers and have been reading the website asking for the priorities and the deepest subluxation, all those things really do help. So I don't know. I think it's wonderful. And it was a little difficult at first switching over my practice, but not really. And I get great results. I'm very happy to do it. My patients love it. And those that are real the diehards that still need to go on the table, occasionally I do KST lying down because I can't convince them any other way. But I do ask the body if it's okay. So prior to doing that, and if it says it's okay, I let them do it. So I tell them they get a free card. So anyway, but that's it. If there's anything you need, have a great time like everyone's saying, ask questions, and real important, move around, touch many heads today and tomorrow, because that'll really help because your patients are all different.